What if a disease had no virus, no bacteria, no parasite, and still destroyed your brain within months? What if it resisted heat, radiation, alcohol, and even standard sterilization? This is Prion Disease, and today we'll explore Creutzfeldt-Jakob Disease, one of the most lethal and scientifically disturbing conditions known to medicine. A prion is a misfolded protein, specifically an abnormal form of a normal protein called PRPC, cellular prion protein. The disease-causing form is called PRPSC, scrapie prion protein. Key characteristics: no DNA or RNA, cannot replicate normally, forces other normal proteins to misfold, extremely resistant to heat, UV radiation, alcohol, formalin, standard autoclaving. This makes prions uniquely dangerous in medical settings. Misfolded prions accumulate in brain tissue, leading to neuronal death, astrocyte activation, loss of synaptic connections, formation of microscopic holes. This results in Spongiform encephalopathy. The brain looks like a sponge under a microscope. Human prion diseases include Creutzfeldt-Jakob Disease, CJD, variant CJD-V, CJD, Gerstmann-Streusler-Scheinker syndrome, GSS, fatal familial insomnia, FFI, Kuru, historical, CJD accounts for over 90% of all cases worldwide. Types of Creutzfeldt-Jakob disease, detailed. 1. Sporadic CJD, SCJD, 85 to 90%. Cause: spontaneous misfolding of prion proteins. No known trigger: age group. Typically 55 to 75 years. Key features: rapid dementia, myoclonus, short survival, 4 to 6 months. 2. Genetic, familial CJD, FCJD. Cause: mutation in PRNP gene, chromosome 20. Inheritance: autosomal dominant. Clinical clues: family history, earlier onset, slower progression than SCJD. 3. Iatrogenic CJD transmission routes, dura mater, grafts, corneal transplants, neurosurgical instruments, cadaver-derived growth hormone. Modern sterilization has made this extremely rare. 4. Variant CJD, VCJD, mad cow disease. Cause: consumption of beef, infected with BSE. Distinct features: younger patients, teens, 40s, prominent psychiatric symptoms. First, longer disease course, lymphoid tissue involvement, incubation. Period can range from years to decades. Variant CJD, 5 to 15 years. Genetic forms, dependent on mutation. Long incubation makes surveillance difficult. Detailed symptoms by stage. Early stage, weeks 1 to 4. Anxiety, depression, irritability, personality change, subtle memory loss. Visual hallucinations, poor balance, insomnia. Intermediate stage, weeks 4 to 8. Rapid cognitive decline, severe confusion, speech difficulties, ataxia, loss of coordination. Myoclonus, sudden jerks, blurred or double vision. Late stage, weeks 8 to 16. Akinetic mutism, incontinence, dysphagia, severe muscle rigidity, coma, death, usually due to infection or respiratory failure. Although Creutzfeldt-Jakob disease and Alzheimer's disease both cause dementia, they are fundamentally different disorders. CJD progresses extremely rapidly, with severe cognitive decline occurring over weeks to months, whereas Alzheimer's disease develops slowly over several years. The underlying cause of CJD is a misfolded prion protein, while Alzheimer's disease is associated with the accumulation of amyloid plaques and tau tangles in the brain. Patients with CJD often experience involuntary muscle jerks, myoclonus, early in the disease, a feature that is rare in Alzheimer's. Additionally, CJD is universally fatal, usually within 1 year of symptom onset, whereas Alzheimer's is a chronic progressive condition in which patients may live for many years. These differences are critical for clinicians, as rapid progression strongly points towards CJD rather than Alzheimer's disease. Diagnostic workup in depth. CSF tests, 14-3-3 protein tau protein RT-QuIC test, highly specific. MRI brain, cortical ribboning, basal ganglia, hyperintensity, pulvinar sign, variant CJD, EEG, periodic sharp wave complexes, genetic testing, PRNP mutations, definitive diagnosis, brain biopsy, rare, post-mortem autopsy, gold standard. Treatment, why there is no cure. Prions cannot be destroyed without also destroying the brain tissue itself. Supportive care includes benzodiazepines for myoclonus, opioids for pain, antipsychotics for agitation, nutritional support, hospice care, infection control, and hospital precautions, use of disposable instruments, sodium hydroxide or bleach sterilization, special prion decontamination protocols, restricted autopsy procedures, prognosis, and statistics. Median survival, 5 to 7 months, 90% die within 1 year. VCJD survival, 12 to 24 months. Case fatality rate, approximately 100%. Public health and surveillance. Mandatory reporting in many countries, national prion surveillance centers, food safety regulations, blood donation restrictions, current research and future directions. Research focuses on prion replication, inhibitors, antibody-based therapies, gene silencing, PRNP knockdown, early biomarker detection, protein misfolding blockers. No therapy has yet shown survival benefit. Ethical and psychological impact, rapid loss of independence, emotional trauma for families, genetic counseling dilemmas, end-of-life decision-making. Prion diseases challenge everything we know about life, infection, and medicine. Though rare, they remind us how fragile the brain truly is, and why research, awareness, and prevention matter more than ever.